Greetings from Indian Journal of Anaesthesia. I, Dr. Khushbu Pandey, will be presenting an original article from Indian Journal of Anaesthesia, July issue, comparing patient education tools for chronic pain medications, artificial intelligence chatbots versus traditional patient information leaflets. The rise of artificial intelligence chatbots in medical literature has sparked interest in their potential for patient education. However, despite their potential benefits, concerns exist regarding the accuracy and reliability of AI-generated content due to inherent limitations in language models. While AI chatbots offer streamlined information delivery, their reliability and accuracy requires scrutiny to ensure patient safety. In this study, the authors compared patient information materials from ChatGPT and reputed sources such as British Pain Society (BPS) and Faculty of Pain Medicine (FPM). The authors focused specifically on common pain medications prescribed for conditions such as neuropathic pain and depression, including amitriptyline, duloxetine, non-steroidal anti-inflammatory drugs, and pregabalin. Thus, the study's primary objective was to compare the accuracy and completeness of patients' education materials generated by ChatGPT with those from established sources like BPS. The other objectives were to assess the readability, emotional tone, actionability, and understandability of ChatGPT generated information compared to BPS standards. The study did not involve any direct human interaction, so institutional review board approval was not sought. Appropriate permissions were sought and granted to the FPM to utilize their patient information leaflets, PILs. This study adhered to ethical guidelines, ensuring the confidentiality and anonymity of patient materials and participants. Blinding process and sequential labeling of annexures was ensured. The data were collected and recorded in Microsoft Excel, and results were evaluated using the statistical online test calculator and using Microsoft Excel. The study employed a comparative design to evaluate patient information materials generated by ChatGPT against traditional material sources from reputed organizations such as Faculty of Pain Medicine and BPS, which are available in the public domain for healthcare workers and patients. The comparison focused on multiple dimensions such as readability, emotional tone, accuracy, completeness, actionability, and understandability. 8 blinded annexures were prepared for evaluation purposes. Annexures A to D contained traditional PILs obtained from the BPS, whereas annexures E to H comprised patient information materials generated by ChatGPT for the same medications, structured similar to PILs. A panel of 5 experts was assembled to assess the accuracy and completeness of each annexure, who were selected based on their proficiency in evaluating patient education materials and further performed evaluation of annexures. BPS annexures consistently showed higher readability levels with a mean FRE score of 62.25 compared to 48 for ChatGPT generated text with a p-value of 0.001. Additionally, BPS materials had lower GFI scores, a mean of 11.85, than ChatGPT generated text, which had a mean of 13.65. Again, the p-value was highly significant. Regarding the sentiment analysis, diverse emotional tones were observed across the materials. Patient education materials assessment tool, that is PMAT analysis, showed that materials from BPS generally exhibited comparable scores to ChatGPT generated text in understandability and actionability. Regarding accuracy and completeness of evaluation, both BPS materials and ChatGPT generated text received high ratings for accuracy and completeness from the expert panel. These are the results as shown by the authors regarding the readability scores and PMAT analysis scores. The study results consistently showed that BPS materials were easier to understand than ChatGPT generated text. This indicates that traditional PILs may be more accessible to a wider audience based on established readability metrics. The result also suggests that BPS materials are more readable, potentially facilitating easier comprehension. While traditional PILs tend toward negative sentiments and ChatGPT generated text convey more positive tones, caution is warranted in interpreting emotional tones' impact on patient engagement and understanding. The findings suggest varying emotional expressions within the materials, potentially impacting reader engagement. The BMAT scores indicated comparable level of understanding and actionability between BPS materials and ChatGPT generated text. Both set of materials received high ratings, suggesting that they are perceived as effective in facilitating patient comprehension and guiding actions based on the information provided. As a limitation, the study's narrow focus on pain medication might miss other crucial patient education materials for chronic pain management. Secondly, standardized metrics may not fully capture patients' understanding or emotions. Expert ratings are subjective and may be influenced by biases. Also, cultural and healthcare differences may limit the findings' applicability beyond the specific context. In conclusion, AI chatbots offer efficient information delivery, yet ensuring accuracy, readability, and patient centeredness remaining crucial to the audience. While they show promises as supplements, they may not fully substitute traditional methods of information dissemination. Balancing innovation with evidence based practice is vital for delivering high quality healthcare information. Thank you.